COVID-19 in women, vitamins and supplements reduced risk of COVID-19 in women. Don't run out to the pharmacy to stock up yet, the survey data is far from conclusive. The new data showed a correlation between regular use of probiotics, omega-3 fatty acids, multivitamins, and vitamin D supplements and a lower rate of testing positive for COVID-19. This video brought to you by HealthyRN Ways channel that talks about the COVID-19 pandemic, video posting every Monday and Thursday. To see my other videos, see the link at the end card of this video. Regular use of certain vitamins and supplements may correlate with a lower risk of COVID-19 in women. The recent data found a lower rate of infection with COVID-19 among women who used multivitamins, probiotics, omega-3 fatty acids, and vitamin D supplements. On the other hand, use of vitamin C, zinc, and garlic supplements showed no effect in lessening COVID-19 risk. None of the supplements were linked to a protective effect against COVID-19 in men. The dataset included thousands of people who answered questions about supplement use and COVID-19 infection on the COVID Symptom Study app, which was available in the United Kingdom, United States, and Sweden. While the findings are intriguing and constitute some of the first data on supplement use and risk of COVID-19, the researchers are quick to warn that their work is preliminary, given that it's based on self-reported data, and certain factors may not have been adequately controlled for. The bottom line is our research is an observational study and not a clinical trial. We can't make strong recommendations based on the data we have. The research, which was published, The Prevention and Health, is exciting because it's some of the first large-scale data available on supplement use and COVID-19 risk and provides a good jumping-off point for further research. This is probably the biggest study to date looking at COVID-19 and supplement use in a real-life setting. Probiotics, omega-3s, multivitamins, and vitamin D linked to lower COVID-19 risk. The beginning of the pandemic, there's been plenty of speculation about the benefits of taking vitamins to bolster the immune system against COVID-19, but very little data to support any claims. The UK supplement market skyrocketed by 19.5% at the start of the first lockdown in March 2020, with a 110% rise in vitamin C sales and a 93% increase in multivitamin sales. In the United States, zinc sales increased by 415% over a 7-day period in March 2020. The team analyzed data from a subset of 445,000 COVID symptom study app users. The app, which launched in late March 2020, also collected user information about symptoms of COVID-19, COVID-19 test results, stress and mental health, changes in weight, diet and exercise habits, and vitamin and supplement use. The app also asked users for information such as age, location, body mass index, ethnic background, socioeconomic status, and whether they're a healthcare worker or not. When it came to vitamin intake, the researchers asked users if they had taken any of the following supplements at least 3 times a week for more than 3 months: omega-3s, probiotics, garlic, multivitamins, vitamin D, vitamin C, and zinc. The dataset included self-reports from 45,757 Americans who used the app between May to June 2020. 71% of American users reported taking supplements while 29% didn't. Over the 3-month period, 3,213 people reported having tested positive for COVID-19. Americans who reported taking probiotics, omega-3 fatty acids, multivitamins, and vitamin D respectively had an 18%, 21%, 12%, and 24% reduced risk of reporting testing positive for COVID-19 during the 3-month period. When the researchers controlled for sex, age, BMI, smoking habits, and underlying health conditions, the data revealed that for the men in the study, there was no protective effect against COVID-19 linked to use of any of the vitamins and supplements. The UK and Swedish data showed similar patterns. It's unclear why the data showed a link between supplement use and COVID-19 for women but not for men. It's worth pointing out that according to the app data, women also tended to report staying at home and canceling plans more than men, and there were more women in the study, including from the United States, the United Kingdom, and Sweden. Researchers say more data is needed before people change their supplement behaviors. The researchers point out several significant limitations of the data in the paper. For starters, the study relied on users self-reporting their vitamin intake with a list of 7 options. The researchers don't know how much users were taking of each nutrient and whether they were taking any other supplements. A health bias may also be at work. Users voluntarily downloaded the app and tracked their COVID-19 symptoms routinely. The majority of users were taking supplements, meaning the group may have been more health conscious to begin with, and thereby more careful with other health behaviors, like hand washing, wearing a mask, and social distancing, which we know help protect against COVID-19. People wait before stocking up on vitamins and supplements in an attempt to stave off COVID-19. Imagine people who took probiotics for COVID-19 prevention would also be better at wearing a mask. If that is the case, the link between probiotics and lower COVID-19 risk may be a correlation of behavior or other factors. Probiotics users were stricter about wearing masks and other health measures, and mask wearing may have actually been the reason they were less likely to get COVID-19. It is not recommended for patients to take supplements, but, if they are taking it before the pandemic, they might as well continue. It is randomized controlled trials to really know if they work. There is very little data to show that vitamins and supplements improve health, as most people get these regularly in their diet. What does help boost the immune system's ability to fight COVID-19? Sleep, managing stress, eating well, and moving. There are 4 pillars to strengthening your immune system. They include nutrition, adequate sleep, managing stress, and regular exercise. If you're skimping on sleep or not managing stress, supplements probably aren't going to make up the difference. Overall, the new study adds to the growing library of research on supplements' effectiveness in strengthening the immune system. There are a lot of nutrients that are important in supporting your immune response, so if you do get exposed, you don't get sick as much. Whether you get these vitamins through supplements or food is up to the individual, but I would certainly start with food. Consumers should rely on vitamins only if they've been tested and know they're vitamin deficient, if their diet is lacking in fresh produce, or if they have a medical condition that requires supplementation. Meanwhile, researchers continue to investigate potential links between supplement use and risk of COVID-19 infections. Earlier this year, researchers at the Chinese University of Hong Kong found that the microbiome, or the variety of bacteria in the gut, may influence patients' immune system response to COVID-19 and the severity of disease. The study, published in April 2021 in the journal Gut, is just one in a series of large-scale research efforts to better understand if supplements, in that case, probiotics, can help in reducing COVID-19 infection or duration of illness. There are also 2 clinical trials underway, one led by UK scientists and another run by a French team, looking at vitamin D and its potentially protective effect. This is all about today's video. Please like, share and subscribe to my channel. Thank you for watching. See you on my next video. Masalama.